Hello, hello. My name is Jones, and today we are going to look at alcohol abuse. An alcoholic drink contains ethanol, commonly termed as alcohol. Alcohol is a psychoactive drug that is a central nervous depressant, and rapidly is absorbed within the bloodstream. It can be addictive, and the state of alcohol addiction is known as alcoholism. So when we're talking about alcoholism, we are just looking at the state of alcohol addiction. So this topic is discussed in mental health because of some conditions that are related to mental health that are associated with the alcoholism or alcohol abuse. So let us look at some of the physiological effects of alcohol use. When a person drinks alcohol, he or she may experience relaxation and loss of inhibition initially. However, when the large amount of alcohol is ingested, intoxication may result or may occur. The person who is intoxicated may experience certain manifestations which include slurred speech, unsteady gait, lack of coordination, decreased attention span, reduced concentration, impaired memory, or impaired judgment. An overdose of alcohol in a short period of time can also result in vomiting, loss of consciousness, or respiratory depression. Some of the physiologic effects of long-term alcohol use, which may also include mental health, psychiatric manifestation. So we can look at these physiological effects of long-term alcohol use as cardiac myopathy, which is more of a medical condition or represent as a medical condition. Then we have phrenic encephalopathy affecting the brain, meaning may present as a mental health condition or may have some mental health deficiency presentation. Then we have Korsakoff's psychosis, which is a mental health condition. Then we have pancreatitis. We have pancreatitis may not have full psychiatry presentation. We may have esophagitis, hepatitis. And then we may have cirrhosis. In cirrhosis, if there is encephalopathy, then it will present as a mental health condition. Then other conditions or physiological effects of long-term alcohol use may be leukopenia, thrombocytopenia, or ascites. Cardinal to mental health includes phrenic encephalopathy, Korsakoff psychosis, and the encephalopathy that may come because of cirrhosis. Now let us talk about treatment of alcohol overdose. When someone has had an alcohol overdose, gastric lavage or dialysis may be done. So when you perform gastric lavage, you reduce the amount of alcohol content that is in the stomach. And then when you do dialysis, you remove the amount of alcohol in systemic circulation. So because alcohol depresses the respiratory system, there will be need for respiratory support, and also depresses cardiovascular function, so there might be need for cardiovascular function. So if someone has had alcohol abuse or has abused alcohol, after an overdose, they may need respiratory or cardiovascular functioning support. So let us now talk about alcohol withdrawal. When an alcoholic withdraws from alcohol use, withdrawal symptoms usually starts at about 4 to 12 hours after a marked reduction or cessation of alcohol intake. The withdrawal may take 1 to 2 weeks. It can be life-threatening, thus prompt treatment and management is required or necessary. If you feel like, let's say, you need some medical attention concerning alcohol withdrawal, it's important that you seek advice of a clinician. But to note the signs and symptoms of alcohol withdrawal, we can just list some of them as coarse hand tremors that can be seen, sweating, elevated pulse, increased blood pressure, insomnia, anxiety, nausea, and vomiting. Okay, so if let's say alcohol withdrawal symptoms are not treated in time, or they are not attended to in time by the medical personnel, we also see this condition that manifests, which is known as delirium tremens. Okay, so in cases where these are withdrawal signs and symptoms, that is the alcohol withdrawal symptoms, are not treated, we see delirium tremens. So this is a progression. Delirium tremens is a progression of alcohol withdrawal syndrome or untreated alcohol withdrawal symptoms. So delirium tremens is necessarily an acute episode of delirium that is mainly caused after a long period of drinking and stopping taking alcohol abruptly. So for the person who is experiencing alcohol withdrawal symptoms. So it also can be triggered by head injury, infection or illness in people with a history of heavy use of alcohol, or a list of signs and symptoms of delirium tremens which may include hallucinations, seizures, and delirium may be seen when someone has delirium tremens. So delirium tremens is more of a complication of alcohol withdrawal symptoms, okay, of untreated alcohol withdrawal symptoms. So we see delirium tremens. Okay, so general management of alcohol withdrawal is that there should be detoxification under medical supervision. Okay, there should be mild alcohol withdrawal symptoms, and that client can necessarily, like for client with mild alcohol withdrawal symptoms, these they can manage to abstain and take care of the signs and symptoms that may present. This may be coupled with taking a lot of water, okay, and engaging in exercises and hobbies that can drive their mind off alcohol. Okay, but otherwise, the patient may need to, or the doctors or medical practitioners may use benzodiazepines, okay, such as Librium or Ativan or diazepam. This is to suppress the withdrawal symptoms. Okay, so there is a fashion of treatment that can be followed in alcohol withdrawal. That is diazepam, 10 milligrams QID, then 10 milligrams TID. So that is day 1. You take 4 milligrams QID. Day 2, you take 10 milligrams TID, that is 3 times a day. When I say QID, that is 4 times a day. So the first day is to take for 4 times 10 milligrams, 4 times a day. Okay, so that is 6 hourly. Then the second day, they will need to take this diazepam, that is 8 hourly, or TID, which is 3 times a day. Then on day 3, they will need to take BD, that is twice a day, of diazepam, 10 milligrams. Okay, then day 4, OD, or once daily, of diazepam can be taken, because this regimen can necessarily help to take care, okay, take care of alcohol withdrawal symptoms, approximately on a 5-day schedule. Okay, so alcohol detoxification affects a lot of alcohol abuse. Okay, affects a lot of people. So the art of knowing how to do alcohol detoxification is very important to avoid people having alcohol withdrawal symptoms or having some complications that have to do with the alcohol withdrawal symptoms. Okay, so remember, if the signs and symptoms of alcohol withdrawal symptoms are severe, patients may need admission. If they are mild, these can be taken, the withdrawal symptoms can be managed at home, of course, with some supervision from the health personnel. Okay, so there you have it. Today we have been looking at alcohol abuse. In our discussion, we have discussed that alcohol is a drink that contains ethanol, which is commonly termed as alcohol. Alcohol is a psychoactive drug and is a central nervous system depressant, which is rapidly absorbed in the blood system. Alcohol is addictive, and hence one who has been addicted to alcohol then will term the situation as alcoholism. We discussed some physiological effects of alcohol use, which included slurred speech, unsteady gait, lack of coordination, decreased attention span, impaired memory, and impaired judgment. Then, if one has taken an overdose, we start seeing vomiting, we see loss of consciousness, and we see respiratory depression. This is in an overdose. Then in long-term use of alcohol, we see people with cardiac myopathy, Wernicke encephalopathy, Korsakoff psychosis, and then we see cirrhosis. What is important to note as to why alcoholism is discussed in mental health is that there are some mental health conditions that may come because of one taking alcohol or because of alcoholism. Okay, so because of alcoholism or alcohol abuse, some mental health conditions will tend to manifest. Then we talked about management of alcoholism, okay, which we said if someone has taken an overdose of alcohol, we can do gastric lavage, and also we can also do dialysis. Then we can also support respiratory system because of suppression of the respiratory system. Okay, so that is it that we have discussed in this presentation. So thank you, and keep studying.